Monsieur le Premier ministre.
Thank you, Mr. Premier. I would hand over the mic to Dr. Arruda. Very well. Hello, everyone. Since the beginning, all of our actions have one target, and that is protecting the health of the population, and particularly those vulnerable amongst us, people over 70. We knew right off the bat that it would be impossible here, as elsewhere in the world, to avoid all cases, and unfortunately, that population that is very fragile is hit by the virus. We also wanted to maintain our capacity to treat cases, that is to say, to flatten the curve and to not end up in a situation like they have in other countries where we would have had to choose between certain people in order to have access to intensive care, and that worked. The curve was flattened thanks to the work that you did together with us, thanks to the fact that you respected the guidelines. And you know, for public health, limiting the freedom of people, we have to have good reasons. And here it was to save lives, and I am convinced that we saved many, and that we did not have to make difficult choices like they had to elsewhere in the world. As measures, we banned visits in CHSLDs and in residences for the elderly. We banned visits, and it worked. The situation would have been much worse had we not done so. Our hospitals would be full to the brim right now with a lot of people that would be in hospitals and in ICU. But it has to be understood that, for example, with the knowledge that is improving, we realize today things that we didn't know at the beginning of the epidemic, that some people were asymptomatic and could contaminate people around themselves. And that is probably what happened with people who were coming back from traveling or who caught it elsewhere and who went into CHSLDs where there is an important concentration of very vulnerable people. And it brought about the deaths that we are seeing right now, which disturb all of us, of course, and which are a phenomenon that we have observed elsewhere in other provinces and other places where there is a concentration of elderly people. A lot of people write to us. I get a lot of personal emails to change the guidelines. Today, I would like to ask the collaboration of everyone to respect to the letter what we'll be doing in CHSLDs. The Premier already talked about a few elements of it, but I have to tell you, it is very important that you understand that you must respect what we're telling you right now. This is only for CHSLDs, where the most vulnerable people need much more concentrated care in terms of hours than what is to be found in other residences for the elderly. And this will be done for these patients and their close caregivers. It has to be understood that these are people who were known before the pandemic. These were people who went regularly before the pandemic to offer either food or helping drink or basic hygiene. There's about 10% of people in CHSLDs that have that kind of natural caregiver. It is sad. I know it's going to be difficult for the children who used to go see their parents over the weekend because they worked, etc., and they didn't have the ability to become that caregiver. But I want to tell you that we can't open up the door intensely in the present context. This is a voluntary measure, and I want to reiterate here, we're not forcing anybody who used to do it to come back and offer care. It is one person for one patient. Those people used to come before the crisis, and as I said it, they offered certain kinds of care. It's not for families and visitors. I understand that it's difficult, but it's not the time. These people will be identified by the management of each facility. They are the ones who know who came before, and they will have to meet certain criteria and sign an agreement so that they know what they are exposing themselves when they go to that place. And they will have notes. There will be notes for the establishments, for the patients, for the caregivers to know what to do in what situation. And if ever anybody develops symptoms, we'll tell them exactly what to do. This measure will start Thursday morning to allow us to better prepare all instruments, the material that will be necessary. You know, the people in CHSLD's managers are very solicited to offer better quality care, the best quality that they can. If you are a person who is not in that category, I would ask you to not put extra pressure or to complain against the choices that will be made by those facilities. They are not the ones who are making these rules. We are. And I have to tell you that we have to go step by step, because if it becomes chaos, we'll have to take a step back and we'll all lose out. So please, I beg you to be patient, and I know it's difficult, but please respect the guidelines that we will be giving, but we will allow certain people who are former caregivers with people in situation of great vulnerability to have that contact again. The more we respect this, the more we'll get out of everything quickly, and the more we'll be able to broaden the approaches, and the more we'll be able to come back to normal. I thank you, and I ask you, especially to those who are not meant to be affected by this measure, because it will be the majority of people, to please respect it, even if you find it difficult, what we're asking you again. Thank you. Question period. We'll start today with Patrice Bergeron. Hello. Mr. Premier, I quote you, last week in the press conference you said that you were meeting the health teams every morning, and I ask my team, is the head of the facility competent? Does that mean that there were incompetent ones? And what do you do if somebody answers you that they're not competent? Well, we help them out. That's what we're looking, and that's what the objective is. It's to look and see whether the situation is managed correctly. Are there hot zones and cold zones? Does the staff know exactly how to use the equipment, et cetera, et cetera? So I don't know if you're referring, for example, to the Heron CHSLD, but we knew that there was a problem with management there, but we didn't know the scope of the problem. I'm telling you today that there's 41 residences that we're keeping an eye on very closely, where there are a lot of cases, amongst other things. So that is the role of those who are responsible of those facilities, to make sure. And we went to do even further. There are people who went to visit physically each of those 2,600 residences, so they had the time to meet with management, to ask a few questions, and to see who has the situation well under control and who doesn't. I have a question of a colleague who says, we know that you're worried by the economic recovery. Are you going to review the migration thresholds downward if it's slower than predicted? We're not there. But in fact, it is something that we'll be studying. We have to review everything, and amongst that, the number of immigrants. With the high rate of unemployment that we're going to have in the next few months, we might, yes, reduce that number.
Bonjour. Dans les gens que vous voulez...
In the people that you want to bring back to CHSLDs, you talked about 1,200 people who are absent. Does that mean that you need 1,200 people, or you need more? Or, well, as I was saying, first, we were missing people before. However, now, temporarily, we've taken people from the hospitals to bring them to CHSLDs, so we have filled a good part of our need there, but those people are going to have to eventually go back to the hospital, because we're going to have to start back with, for example, operations that were delayed. A great hope that we have, it's 2,600 teachers who know healthcare and who could come and work in CHSLDs. I mean, that would be extraordinary. We have adopted a decree to be able to do so. Those people are already paid. Our teachers are still being paid, and they will have the right to that premium that is given in CHSLDs. So I'm calling out to their sense of duty more than anything. We need them right now. You're talking about professors. That brings me to the next question. Back to school. I know that the date isn't determined, but will professors be forced to go back to teach, because some of them are perhaps 60 and over, others are perhaps affected by more fragile health conditions, so will that be mandatory? Well, we're not there yet. I said so before we ask teachers and professors to go back to school, and we ask children to go back to school. We're going to have discussion with Dr. Arruda to see what measures we have to set up. Will it be full classes? Will it be in all regions? What are we going to do with those teachers who are over 60? That's the kind of question where we'll have guidelines, but I want to be quite clear. We're not there yet. There's no question of reopening schools in the short term.
Monsieur le Premier ministre, Madame McCann, Monsieur Arruda. Ma question s'adresse à Madame McCann.
My question is for Ms. McCann. You said that you are looking for people, that there's staff missing in CHSLDs. I'm told that the Hygiene Federation by your ministry to come help out in the network. Well, listen, we're going to be looking at that quickly because you're right. These are people who do have training, basic training that is very interesting. So I am taking good note of it. And I would like to add that any professional order that considers that they could give us a hand, we are open to that. So we are going to do a follow-up very quickly. Because as the Premier says, we need everyone. And I would like to add as well that we have people who work in social economy enterprises who take care of people at home a lot, but some are available right now so that they can help us in CHSLDs. These are people with a lot of experience who can give a lot of basic care. So thank you, and if you have any other suggestions, our follow-ups are done very quickly in the present context. Mr. Arruda, when you made the projections last week, well, not you, you weren't there, but Dr. Massé, thank you. We were talking about a peak in the pandemic that would be around the 18th of April. Is that date in your projections, the way that it's going right now? Is that still a plausible date, or do you think it will be earlier or later? Have you adjusted yourself to that? If we're talking about the peak in the number of cases, because there's a difference between the peak in the number of cases versus a peak in hospitalizations and a peak in deaths, because they're not at the same time. You know, you catch the disease, but you don't die right away of it. So I think that the projections are about the peak of cases are adequate, perhaps even potentially earlier. That means that we right now observing, and we have to make the difference between different regions, and we have to have the stability of data as well, because despite the fact that we announce to you cases every day, sometimes it's cases from the previous evening that weren't in the system right away. You know, it is complicated from the hospital to public health, and then there from that to the system and investigations, because of course we try to get statistics as quickly as possible, but our priority is to give care. So I think that probably we are in the peak and starting to go down, but this is going to be slow. This is not going to, you know, like since we flattened the curve, we flattened it in both ways. So in fact, you know, we flattened it. It's probably going to go down very slowly as such. And then we're going to have to remeasure the effect of all that. But I believe very important message. Even once at the peak, even once we start going down, we still have to be careful. Don't think that because we got to the peak, we can let go and we open the doors wide open. We're going to do like all the other countries in the world have done, a step-by-step progressive approach, measuring the effects of our opening in certain areas, etc. We'll continue investigating cases and contacts. We're going to have even higher monitoring than at the beginning. You talked these past few weeks of protective medical equipment. Every day we knew which was close to shortage. In CHSLDs, whether they be private or public, at one point in the past few weeks, was there a lack of shortage of this material? Not in the last week, no. And I would say even the last weeks. At the beginning, maybe there might have been certain CHSLDs, private ones that didn't have all the material, but in total, we've never lacked for material. Maybe some people didn't ask for it, but even if we were tight at some point, there was always enough to cover all CHSLDs, all hospitals. For when we start the parliamentary work, we've seen the leaders of the other parties talk to you yesterday asking for virtual meetings to be organized with ministers and members of the opposition. Yesterday, we understood that you weren't interested by this proposal. What will happen beyond the 21st of April about this? No, I had a discussion yesterday, as I have every Monday and every Thursday, with all three heads of the opposition, and we talk about how we could do it after the 21st of April. Of course, it also depends on the people who would be questioned. I think that I don't need to explain that Daniel McCann perhaps has less time to give to that in the next few weeks. But I understand at the same time, particularly with the situation in CHSLDs, that the opposition leaders have questions to ask. So we are finding a solution, and I have good hope that we're find an agreement.
Journal de Québec, Journal de Montréal.
Oui, bonjour à tous. Première question pour Dr. Arruda. La semaine dernière,
Dr. Arruda, last week my colleague asked you whether the elderly who are suspected of being infected by COVID-19 were tested systematically, and your answer was it happened. And we also have information from the field that allow us to believe that it is not done systematically, which makes us think that the death toll must be under-evaluated. So my question is, do you think that the death toll by COVID-19 in Quebec is underestimated, and why is it not systematically tested? Well, there's different reasons, and first I want to say, and I'm checking the definitions of cases in other provinces, but just to give you a comparative example, when you talk about heat wave in Quebec and we count the deaths, very often we don't wait for the investigation of the coroner at the end to know if it's the main cause. For reasons of intervention and surveillance, we count those cases. So we have cases, significant cases in Quebec and Ontario that don't have very many because they wait for the confirmation by the coroner. It's true that it's possible that we didn't test all the cases, but we have a case definition that involves what we call a case with an epidemiological link. So if you're in a CHSLD on a floor where there is one or two cases that were confirmed by lab tests, and in a room next the next room over, you have one case. There's no other cause of death as such. We're almost sure. I mean, at a very high percentage that it's COVID-19. So that will be an untested COVID-19, not confirmed by lab, but considered as being a case. So those cases we have. And you will see that we have more and more because, and we often do it in investigation, we don't test everyone. We know that the disease is circulating right now. We're not in flu season anymore. So the possibility that it is a higher case is true, and then it's not a lab test. Is it possible now that people died of COVID-19 and for whatever reason they weren't taken into account? That's true. All systems have always underestimated deaths. In Italy, they think that they may have been 3 times more cases than what were reported. But it's
Speaking on behalf of the province today are the province's Chief Medical Officer, Dr. Jennifer Russell, and Premier Blaine Higgs.
On behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honourable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Good afternoon, everyone. Bonjour.
Good afternoon.
When others are in need, New Brunswickers just want to help, and it's who we are. During the St. John River floods of 2018 and 2019, people rushed to help their neighbors, filling sandbags and moving possessions to higher ground. They donated food to emergency shelters. They gave of their strength to help those in difficulty. And when we see our fellow New Brunswickers struggling, we want to lend a hand. The COVID-19 pandemic has touched this impulse in us, so we want to help in any way we can. And in recent days, many New Brunswickers have reached out to my office asking how they can help. In particular, they have been moved by the bravery of our frontline workers and our healthcare workers, and they want to protect them, help them protect themselves as they protect us. So we are working to make this happen, and I want everybody to know how much I appreciate their generosity. In a moment, I will provide details on how New Brunswickers can donate personal protective equipment to aid those working in our hospitals, nursing homes, and special care homes. La pandémie de la COVID-19.
The COVID-19 pandemic has touched this impulse in us. We want to help in any way we can. In recent days, many New Brunswickers have reached out to my office asking how they can help. In particular, they have been moved by the bravery of our frontline healthcare workers and want to help them protect themselves as they protect us. We are working to make this happen, and I want everyone to know how much their generosity is appreciated. In a moment, I will provide details on how New Brunswickers can donate personal protective equipment to aid those working in our hospitals, nursing homes, and special care homes, and also people working in the community.
Report that there have been no new cases of COVID-19 in New Brunswick today. Our total cases to date stands at 116. Our numbers of new infections have been low in recent days, and we are definitely moving in the right direction, but we have not reached our destination. Tout d'abord, j'ai le plaisir de vous
First, I am pleased to report that there have been no new cases of COVID-19 in New Brunswick today. Our total cases to date stands at 116. Our numbers of new infections have been low in recent days. We are definitely moving in the right direction, but we have not reached our destination.
We must maintain our resolve. We can't let up, not even for a minute. Please continue to stay home as much as you possibly can. Keep doing what you're doing. When you do go out, keep your interactions with others brief and maintain 2 meters of physical distance between yourself and others to keep the virus from spreading. Wash your hands regularly and thoroughly. When you do these things, you are denying the virus the opportunity to move through our province, and you are helping to save lives. I know that many of you want to be more actively involved in this fight, and I have heard of people who want to donate protective equipment and that they possess. Some have stocks of masks, gowns, and medical equipment they purchased when caring for a loved one at home. Some businesses that use protective gear in their daily work have inquired about donating their stock, and others want to turn their hands to sewing masks or making other gear for our frontline workers. These gestures of generosity touch my heart. Je sais que bon nombre parmi vous souhaitent participer.
I know that many of you want to be more actively involved in this fight. I've heard from people who want to donate protective equipment that they possess. Some have stocks of masks, gowns, and medical equipment they purchased when caring for a loved one at home. Some businesses that use protective gear in their daily work have inquired about donating their stock. Others want to turn their hands to sewing masks or making other gear for our frontline workers. These gestures of generosity touch my heart.
It's important that we make sure the protective equipment we use to keep our frontline workers safe is safe for them to use. We have to be certain that this material has not been contaminated in any way. There will be a strict process to vet donated protective gear. Notre personnel chargé de la logistique.
Our logistics and procurement staff have been working very hard through this crisis to make sure our healthcare workers have the equipment they need when and where they need it. They are working 24/7, playing a vital role in protecting the people who are protecting all of us. Information on how to donate is now posted on the GNB coronavirus website. Through a link on the site, you will be directed to fill out and submit a form detailing the type and condition of materials you wish to donate. Specific information on manufacturer specifications, certifications, where applicable, is required so that we can be sure the material is safe to use.
staff have been working very hard through this crisis to make sure our healthcare workers have the equipment they need when and where they need it. They are working 24/7, playing a vital role in protecting the people who are protecting all of us. So the procurement people at Service New Brunswick are playing that role along with our staff and the logistics people. So they're all very, very coordinated. I understand that the Brunswick Medical Society is also part of some of that process. So, and they will have more information on procuring for frontline workers who are in the community. Information on how to donate is now posted on the GNB coronavirus website. Through a link on the site, you will be directed to fill out and submit a form detailing the type and condition of materials you wish to donate. Specific information on manufacturer specifications, certifications, where applicable, is required so that we can be sure that the material is safe for use. If your donation is accepted, specific instructions for delivery will be provided to you. Physical distancing practices will be followed at all times. The desire to help is second nature to New Brunswickers, and all of your efforts are appreciated. Le désir d'aider les autres.
The desire to help is second nature to New Brunswickers
In the fight against COVID-19. Stay healthy. Whether it's your mental health or your physical health, we really, really want everybody to take good care of themselves and to take care of others. We have made significant efforts to free up space in our hospitals in anticipation of the surge of COVID-19 patients. It's imperative that we continue to give our healthcare system the ability to care for those in greatest need. By maintaining your own health at this time, you are helping to keep our healthcare system strong. And you are also helping yourself, as we have seen that those who have underlying illnesses have been amongst those most susceptible to this disease. And that's not to say that people who are in completely good health are not affected, but we certainly see a proportionately higher number of people with comorbid conditions affected severely. Prenez soin de vous, mangez sain, faites de l'exercice.
Look after yourself by eating healthy, getting regular exercise, and plenty of rest. We need you to be well as we go through this pandemic and for the recovery that will follow. Working together and giving to our neighbors has gotten us through hard times before. And it will again.
Look after yourself by eating healthily, getting regular exercise, and plenty of rest. We need you to be well as we go through this pandemic and for the recovery that will follow. Working together and giving to our neighbors has gotten us through hard times before, and it will again. Thank you very much. Merci.
Thank you.
Good afternoon. Bonjour. As we work together to slow the spread of COVID-19, one of the things we have asked of everyone is to stay home. For most of us, home is our safe place. But it's understandable if you're starting to feel just a little bit restless. C'est des temps difficiles.
These are difficult times. We have never experienced a pandemic such as this one, and there's not only one way or the right way to react.
For weeks. Some of you are alone, others with your families. Some are trying to entertain small children, and many of you have been working from home. We are all anxious and unsettled. Cette expérience.
This experience leads to unexpected feelings and fears. While the situation continues, and while we have watched enough TV to be saturated or already read the pile of books that we never thought we could read, it's normal that you feel more and more restless.
Might show up in different ways to different people, but one of the best ways to deal with them is through connection. This isn't something even the most introverted amongst us feeling. It's a need at this point to talk to someone, to have exchange. While in-person connection isn't possible, there are many other ways we can reach out to one another. Check on your neighbors. Déposez une note dans leur.
Leave a note in their mailbox to tell them that you think about them and that you're there for them if they need anything. Call a senior to see how they are doing.
Seniors' homes. Reach out to local businesses and restaurants. Thank them on social media, or if you can't afford to, make a purchase from them. Many local restaurants are doing takeout, and some small businesses are providing online services. Support them if you're able. If you know a frontline worker, drop a thank you note in their mailbox. The next time you go for groceries, offer to pick up items for someone who can't get out. Préparez un repas pour un ami.
You can prepare a meal for a friend and leave the meal on the doorstep with a note to remind him or her that you will reunite once this pandemic is over. You can also help rake someone's lawn.
Friend or family member and take the time to really connect. Do something that helps someone else, and you will feel good at the same time. We are all struggling right now, so finding healthy ways to feel good are important. If you're experiencing intimate partner violence and do not feel safe at home, there are options available to you. Government is working with transition houses and second stage housing across the province to ensure that services are available and provided in a way that protects everyone involved from COVID-19 infection. Si vous avez besoin,
if you need to talk to someone and you're not sure where to turn, you can review the COVID-19 page on the New Brunswick government's website. There's a section on information and family violence support services, including ways for victims, children, and witnesses can get help.
if you need assistance dealing with anxiety, depression, and any other mental issues, the coronavirus page is also a good place to start. There you will find numbers for organizations that can help you get through the challenging time, including the Kids Help Phone, the CHCO Helpline, and Community Addiction and Mental Health Centers. Reach out, connect, and most of all, don't forget to take care of yourself. We can remain physically distant and stay connected to family, friends, and neighbors. In fact, we must do so. One of the many organizations that is making a difference during this pandemic is the Red Cross.
One of the duties carried out by the Canadian Red Cross is the management of the one-time income benefit that is to help New Brunswickers bridge the gap until the emergency federal fund is implemented.
To date, more than $30 million has been distributed to over 33,000 New Brunswick workers. We are working through the rest to make sure that all who applied and are eligible will receive this funding. This is money that is helping people across the province at a time when they need it most. As a government, we will continue to find ways to support the people of this province as we face the challenges of COVID-19.
With the arrival of spring, the pandemic is not the only concern for many New Brunswickers. I would like to take a moment to speak to people who live along the rivers and waterways in New Brunswick.
Anyone living along waterways to remain vigilant. There was some localized flooding in the Sussex area overnight. Due to Monday's heavy rainfall, the water came up quickly on the Trout Brook in areas around Sussex and Sussex Corner that are prone to flooding. No evacuations were necessary, and water levels have since gone down. Waters are expected to surpass flood stage this week in Gagetown, with the river level showing as at flood level of 4 meters for both Thursday and Friday. Saint-Hilaire will be just below the flood level on Thursday. People should exercise caution as the spring freshet is underway and water is high. Les équipes de la
New Brunswick Emergency Measures Organization teams, as well as the Department of Environment and local governments, as well as their partners throughout the province, are always paying attention to what's going on with the St. John River in the spring.
It's true this year. We can forecast river levels, but ice jamming is always unpredictable. The Emergency Measure Organization and its partners have factored the situation with COVID-19 into their planning. For example, they've examined the requirements of social distancing and protective masks put on sandbagging operations in case that is required. Ils ont étudié la façon dont le travailleur.
They studied the ways how workers can carry out their duties while maintaining physical distancing and what type of cleanup could be required.
And in past years, some people have had to evacuate because of flooding. A good number of them would stay with friends or family. This is not an option this year because of the need to observe social distancing. So if flooding forces evacuation, the Canadian Red Cross will help provide temporary lodging. If and when this service is needed, registration information will be shared. Pour l'instant, les prospecteurs.
For now, the forecasts are good, but we need to be ready. We all hope that this will not happen, but I want to reassure you that measures were taken in terms of planning and preparation.
At all levels, we'll continue to work together to address the challenges facing New Brunswick right now. And we will continue to keep you informed. Everything we're doing, we do with the health and safety of New Brunswickers as our primary focus. What I know for sure is that New Brunswickers are resilient and caring, and together we will get through this. And I know it's great news today to hear of no new cases. And you know, I'm hoping the next number of weeks will be boring in that sense and we won't see new cases, but that's unlikely to be the situation. We do feel that the flooding situation is not going to be anywhere near what we've seen in the past 2 years. In fact, we're expecting normal conditions, but that's too early to tell given the pending ice jams that are a potential. But I know we'll get through this, and right now, boring is what I'm looking for. I'm looking for it to be quiet, peaceful, so that when it comes May and the weather really gets good, we will have a really solid track record that will say, you know what, maybe we can think of doing things differently. And I am looking forward to that as much as you are. Thank you. Merci.
Merci, Monsieur le Premier Ministre. Thank you, Premier. Thank you, Dr. Russell. Questions from the media. Each reporter will have one question, and you have the right to pose your question in the language of your choice.
We will now move on to media questions. Every reporter will have the right to ask questions in the language of your choice. Every reporter will have one question. Vicky Hogarth.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, I was speaking with Dr. McDonald this morning from the Institute of Research, Data and Training, and he said that while New Brunswick so far has been useful, our testing so far has been useful in pinpointing people who need to isolate, it hasn't been as effective in terms of understanding how many people have been exposed to the virus and the nature of the disease. And while he recognizes that resources and financial limitations might make testing everyone not feasible, he thinks that a random sampling of population testing could shed a lot of light on disease dynamics and transmission pathways. Now that you're opening up testing a bit more, would you consider testing an entire small community so that researchers have data to better understand the nature of COVID-19?
Yeah, so that's a very good question, and there's a few parts to that. Yes, we have opened up our testing, and so that'll give us a good idea, again, if there's more community transmission that we're just not seeing, although, again, our numbers in hospital and ICU in terms of percentage of transmission, in terms of that proportion and reflection of that, again, keeps us hopeful that perhaps there's not a lot out there. More information is better, obviously, and there are different ways of testing, whether it's random, whether it's in an entire community, whether you're using the current testing regimes or the newer ones that we could see in the future that already are taking place in other jurisdictions around the serological testing and looking at immunity. So all of these things are part of our discussions, actually. So at the national level, we're discussing these things, and we're also discussing them here at the province level. So they're definitely on our radar, and as things evolve, and we're taking those things into consideration as we move forward in terms of looking at different pieces of data that would help us in making decisions around what is actually happening and what we'd like to see moving forward.
Thank you, Doctor. Vicky, do you have a follow-up question?
Yes, thanks, Bruce, and thank you, Dr. Russell. I'd like to also applaud you for setting up a PPE donation site. And with that in mind, do you think it will ever be possible to get staff of long-term care facilities N95 masks to better protect themselves?
So the issue around what PPE to use is completely dependent on what type of medical procedures are being done and the risk associated with those medical procedures. So we actually have new guidance documents around long-term care facilities and PPE and those types of things. So we're having conversations with social development and the task force around operationalizing those pieces. And it is very important to have the appropriate PPE and the appropriate training as well. So that is also part of the conversation. So it's not just about giving somebody PPE, but making sure that they're trained to use it appropriately at the right time for the right types of procedures in the right settings at the right risk level. So those are all conversations that we're having right now. Very, very important.
Thank you, Doctor. Thank you, Vicki. Elizabeth Fraser, CBC.
Hi there. My question is for Dr. Russell. We spoke with an infection control epidemiologist today who said New Brunswick could be on the verge of peaking in COVID-19 cases. What is the reaction to this, and do you believe that this is actually the case?
Sorry, who you were speaking with an individual?
From University of Toronto.
Okay. Yeah. So again, we have several epidemiologists on our team, and we have several medical officers and like many parts of our team who look at this data in fine detail. And so definitely, as we've spoken of before, you can't see the peak until after you've passed it. So we're definitely keeping an eye on the numbers. We obviously have a few good news stories the last few days in terms of our numbers being low and the fact that we don't have any new cases today. But in terms of confirming that, we're past the peak, I think we still need to look at probably a few more days and weeks ahead looking back, because you're always looking at a snapshot of 2 weeks behind. So what we're seeing today is as a result of things that happened almost 2 weeks ago with respect to the incubation period. So in an outbreak setting, you're going to need to look at 2 incubation periods to fully realize and understand and make decisions about what the data means and how to analyze it.
Thank you. Elizabeth, do you have a follow-up question today?
Yes, my second question is for the Premier. Paramedics, city works crews, police, and even media sometimes travel inside vehicles together because it's part of their job. Is that okay under the current situation, or is everyone adhering to a one person per vehicle rule?
The distancing, the social distancing should be practiced for everyone, and that includes anyone riding in vehicles. What we have done as our safety officers have checked on people for that very reason, because it's one thing if you're a family and you're living in the same household and traveling together, but it's quite another if you're coming from all different directions and then joining together in a common vehicle, because that's certainly how the disease can be spread throughout.
Thank you, Elizabeth. Laura Brown, CTV.
Hi there, Dr. Russell. I'm wondering, with your announcement yesterday about casting a wider net and testing, has 811 heard from more people? And I guess, has 811 been more inundated with calls?
Yeah, so over the weekend, they did have an increased number of calls based on non-COVID related phone calls, but in the last 24 hours or so, we've had almost triple the number of COVID-related calls, so we actually have more staff being brought in, just like the last time we had a surge to deal with that.
Thank you. Laura, do you have a follow-up?
Yeah, very quickly. I couldn't believe I looked back out today 1 month ago, and a lot has changed, obviously. But one thing that was announced around this time was that Horizon Health and Vitality was going to end elective and day surgeries for the time being. But now that we're seeing, I guess, fewer cases, would you recommend hospitals, I guess, start or begin those surgeries again?
I think that right now we have to stay the course, Laura. I think it's good to have those conversations and discussions, but I think we need to be very careful about monitoring the situation right now. I think the borders being closed is really, really helpful because again, we're seeing a decreased number of the travel-related cases right now, which is very good. And so what we're really, again, trying to get a sense of moving forward in the next 10 to 14 days is around if there is any more extensive community transmission that we need to really worry about. So I think having the hospital capacity being maximized right now has been a really helpful exercise in terms of what can be done moving forward. And so depending on how things shift and change in the next 2 weeks or so, I think it'll be clearer what kind of discussions we need to have around elective surgeries and procedures.
Thank you, Laura. Charles Camiran, TVA, Edmundston.
Oui, ma question.
Yes, my question is for the Premier Blaine Higgs. So over the past few days, we noticed that there were more recovered cases. So in the short term, will you be a little bit more lax with measures that were implemented? For example, could you reopen non-essential businesses over the coming few days and over the next few weeks?
As you've heard from Dr. Russell, the next few weeks are going to be critical, watching a pattern. So if we can get, several days, maybe several weeks, meaning the next 7, 10 days, 14 days of consistent levels of cases or no cases, then that begs the discussion going that for what do you need to look at for maybe additional testing, or how can you relax some measures? But right now, these next 2 weeks are critical in that regard. And my comments earlier about looking at May and saying, are we going to be able to do something differently in May? I hope so. And I hope, to your point of looking at some of the businesses that previously weren't considered essential, can they find ways to operate and still respect safe distancing practices, but be able to get it back in business? We want to make that happen, and it will depend what it looks like over the next coming weeks. And we are right now looking at how we can restart our economy, how we can allow communities to get back to normal, but we have to do it while at the same time not putting ourselves in harm's way and losing the ground that would seem that we've gained at this point in time.
Thank you, Premier. As-tu une suivi, Monsieur?
Do you have a follow-up question, Mr. Camiran? Yes, it would be a follow-up with Dr. Russell. So to make sure that I understand, so it's important for you to strengthen the measures over the next few days. So to still keep those measures of physical distancing. So it will not be more lax over the coming days. Is that correct, Dr. Russell? Yes, so we need to keep going with the measures that are being currently implemented. Thank you.
Thank you, Bruce. Premier, Prime Minister Justin Trudeau said today that a number of the provinces are looking to give temporary pay raises to employees at long-term care facilities following Quebec's lead. Trudeau said the feds will help provinces pay for the increase and that they're in talks with the provinces. I wanted to know if New Brunswick will do this, why or why not?
Well, certainly, Adam, right now, watching our situation very closely and in comparison with other provinces, we hope that our situation remains normal. We hope that our conditions, our hospitals are about 50 to 60% capacity at this stage. ER activities down by about 50%. So we're actually thinking, is there a way that we can open up some services again, hoping the numbers stay low and stay the way they are and continue to decline, but that'll be kind of in consultations with Dr. Russell as we go forward. So at this stage, it would be, I can understand why Quebec, moved in the direction they did and potentially Ontario. I hope we're not forced into the same situation because of an outbreak that it gets, out of control. So at this point, we want to make sure that people are able to work their normal shifts. They're able to do that and have a normal as life as possible, knowing that restricted one at home is different. So we're in a little different place than other provinces in that regard. I'd like to think we would be able to stay in that different place because of the lack of urgency.
Adam, do you have a follow-up?
Yes, please. For Dr. Russell, today's zero increase comes after 250 new tests over the last 24 hours. Neighboring Nova Scotia, potentially comparable for the province, has 43 new cases today, its worst day yet, but they tested more than 1,400 people yesterday. Why the discrepancy in testing? Over 1,200 more tests than neighboring Nova Scotia yesterday. I thought New Brunswick was supposed to be ramping up, and why can't it test at that level?
We absolutely can test at that level. We just haven't had the demand. We have changed our criteria for testing. We have expanded it. We have the resources in place with respect to the 811, family doctors doing virtual care in terms of referrals, and then our testing sites are obviously still able to ramp up capacity. So we would definitely aim for 1,000 per day as needed. I think if you look at a graph that would show New Brunswick cases versus Nova Scotia cases, you know, they are on a different trajectory at the moment than we are, and again, we're holding steady in terms of the low numbers recently, but that can change, and so again, as things change and evolve, we will see changes in along with that with respect to the demand. So and we as one of the other reporters asked, we are looking at testing some asymptomatic folks in very specific situations, and that's something that's kind of the next phase of our discussions. But right now we have 200 calls in the queue based on the increased volume of calls to 811 in the last 24 hours. So there's 200 people that still need to have callbacks at this point. So again, we are not at complete capacity right now in terms of we do have room to test more people, and we will should that need arise.
Thank you, Doctor. Thank you, Adam. Ben Burnett, CHSJ News.
Thank you, Bruce. Dr. Russell, with the change in testing for lower severity symptoms, I would think that would be kind of difficult to monitor. You mentioned allergy season yesterday as a possible confusing factor. Many are waking up with a sore throat or sinuses for spring morning anyway. Could you kind of clarify at what level you'd expect someone to call 811? Is it the moment you feel an itch in your throat, or would it be after prolonged symptoms?
Well, again, because there's several symptoms to choose from in terms of having 2 of the 5. It's completely up to the patient when they call 811 and how that works. So we have the capacity, we have the resources. So to offer that level of testing right now, I think is a good thing based on where our numbers are at. And again, things can change and evolve. What we're looking at today is a snapshot of what's happened 2 weeks ago. So again, with the 14-day incubation period, we're just going to keep monitoring things.
Thank you. Do you have a follow-up question, Ben?
Thank you, no.
Thank you, Ben. Monsieur Matthew Wacomo, l'Acadie Nouvelle.
Merci. Ma question est pour le...
Thank you. My question is for the Premier, and it's related to Adam Hura's question. Did the provincial government ask for anything from the federal government to get some help in the nursing homes, whether it's equipment, money, or anything like that?
At this point, all requests that come in through any of the, whether it be the nursing home sector, whether it be through the hospitals, Vitalité Horizon, whether it be in the EMO world, anything that we require, all comes into one central area within health and kind of the emergency response group. And then that is disseminated into requests as required to the federal government or through our own supplies internally. So I don't get specific requests as such, but I would see the general requests that I would review with my colleagues provincially and with the Prime Minister as or the Deputy Prime Minister. So that's the way any requests, and the same for funding levels, whether it be through health or through the business sector, as we're looking for support. They're all coming in from different areas, and then I take those as we need to supplement them and make federal requests.
Do you have a follow-up question? Yes, still for the Premier. So if I understand correctly, you did not ask funds to Ottawa to grant temporary increase in wages for nursing home workers, and if it wasn't done, are you thinking about doing it in the next few days?
Well, at this point, I haven't asked for funds for any sector for increased funding, for individual funding. And it's because our situation has not warranted it, the same as you would see in Quebec or, as I say, in Ontario or BC or many provinces. So I am asking for funding for situations that we have related to here in New Brunswick. And as we go through this, if we find ourselves in situations like other provinces, then we'll do whatever is necessary to work with our employees to make sure that not only are they compensated fairly, but their work conditions are certainly, and their safety equipment that they're wearing is certainly appropriate, and it's available for them as needed. So I base my decisions and our requirements on what our needs are directly, not just because somebody else in another province, asked for it.
Merci, Monsieur Como. Monsieur Michel Corriveau, Radio-Canada.
Merci, Bruce.
Thank you, Bruce. This question is for the Premier, Blaine Higgs. So I would like to know, you talked about a situation in measures in May. So if there are any changes in terms of requirements, how will businesses open up again? So which businesses first, etc. So what can we expect?
So certainly right now, we had about 1,400, I think the number might be a little less, requests that went through Navigator and different businesses to understand their scenario. We are currently categorizing them in the sense of, what business could operate under meeting the social distancing and be able to start up in the community, working with public health to determine when would it be possible and feasible to do that. We want to get the economy moving. I'm getting requests from, different businesses that are, I think, starting to, make more of a public statement about, we think we could follow the rules and get back in business. And I think we certainly want to be able to accept that. We need to do it in a very a methodical manner so that as we move forward, and it could be any business, as long as they can meet the standards, but the timing has to be right, because we do not want to regress. We don't want to slip away from what appears to be right now a very good position. So we have to do it in a way that we can ensure we maintain where we are and not have an outbreak. But I'm sympathetic to the businesses, and I'm sympathetic to people that are not able to move around like they used to, because and we've had some pretty interesting emails and messages, as you might imagine, from some of the fishermen and hunters. So it's like I understand it, I get it, and I'm just asking, be patient for another couple weeks. Let's understand the trends that we're going to get here, and then we will have a path forward to allow businesses to get back into shape while following the guidelines necessary to ensure we don't have an outbreak. But we need to get the numbers in over these next couple of weeks. I'd like to clarify something, if I might. It's unrelated to this particular question, but it is related to a comment when I was asked a question about driving together. And I think just to be sure that it was understood, we have a case where we have paramedics, we have healthcare workers, we have daycare workers that are working in close proximity as part of their everyday job. We're asking, obviously, that the right precautions are taken and the right equipment is worn. But this is part of the job, and we accept there are certain risks to that, and we provide the necessary equipment and precautions in doing so. We have LPNs in hospitals. Obviously, we have nurses in hospitals. So I think, when I made the comment and I talked about, we obviously expect that they must continue to do what they're doing, and they're doing an admirable job. And we commend them for that and need them in many ways. We need them, obviously, to get through this. The area comes down, I guess, in sense, because there was also reporters were put into that. And I guess if we had a bus and everyone can say distancing, then there's possibilities to carpool. But what we have to avoid is the common sense item where we see 4 people or so get together in a small car and drive like they used to, and they're all coming from different areas in the community. That's the challenge. It's kind of a common sense thing is how we manage it. Thank you.
Do you have a follow-up question, Mr. Corriveau? Yes, thank you. So instead of talking about businesses, now we can talk about citizens. People are asking how much longer they can keep going on like this. If we see the situation in New Brunswick where we have a lower number of cases, and you said that the 2 next weeks will be important to determine the situation, what can we expect in terms of citizens? Can they expect more lax measures? How do you perceive this for the next few weeks and for the next few months?
What I said before in relation to this weekend and people adhering to the rules and seeing what we'd get for results over the coming 2 weeks, that's what we're measuring right now. And to Dr. Russell's comments about, we've seen increased testing requests because the requirements have been relaxed. So we're going to see a lot more tests over the coming days. We'll see what that brings. And then if our situation remains unchanged or essentially unchanged in relation to the number of new cases, then it allows us to then say, okay, what can we do? So let's just say that if everything was to remain as is today over the next 2 weeks, there would be cause for us to look at our situation and say, how can we make some changes to make restrictions reduced? But we need to have that behind us first, and then we can make that decision. And New Brunswickers will know. I mean, it won't be something that it'll be a surprise. If our numbers stay flat and we're able to see that over a 2-week trend, then they will know that they can expect something to happen in May that would help us to work our way back to normal. But recognizing that normal is not going to be what it was last year at this time, and normal will be different. But still, getting ourselves back to a way of life that's acceptable for New Brunswickers, and as we want to once again enjoy our province.
Thank you, Premier. Merci, M. Corriveau. Silas Brown, Global TV.
Hi, Dr. Russell. I just want to pick up on this thread about testing that was mentioned earlier. I know that you had said, that the demand isn't there to be doing more than 250 tests. But is there any worry that our numbers here could be artificially low because we haven't been doing the same amount of testing as we've seen in Nova Scotia? Obviously, they're in a different situation on a different trajectory than we are. But is there any possibility of that, of our numbers being a little bit lower than they actually are?
Well, Silas, it is definitely possible, and I would be more worried about that if I was seeing more hospital admissions and more ICU admissions, because we know that that is representative of the proportion that is out in the community. So, again, I've said this before, I don't want to have a false sense of security here, and so that is why it is important to look at the numbers as they evolve in the next week to 2 weeks, because, again, what we're seeing today is a snapshot from 2 weeks ago, basically. So, in terms of moving forward and staying optimistic, cautiously optimistic, we do have to look at the numbers as they come in over the next week to 2 weeks. But certainly, it is obviously a good day when we're not announcing a new case.
Thank you. Silas, do you have a follow-up?
Yeah, one for the Premier this time. I know that you've spoken about long-term care homes today, but I'm curious if you think that there's anything that the federal government could be doing to better protect residents of long-term care homes.
We're going to be sharing some information in the coming days, but a lot of work has been done from the both in Vitality and Horizon in actually training home care workers and our nursing home workers so that they're using best practices, they're using the right equipment. So, you know, I'm feeling good about the process that's been underway in terms of training and in terms of what's being done in each nursing home. So I'm getting very good reports in that regard. I guess as again we go forward, we'll be looking if we need to do anything further. And I have updates that we'll be given the COVID committee, our leaders group, this tomorrow night to go through the what's been done to date in nursing homes, so we can all understand, be on the same page of what's required, and if anything more, because we will do whatever is recommended or necessary in that regard.
Thank you, Mr. Brown. Colin McPhail, CBC.
Thank you, Bruce. This is a question for either Dr. Russell or the Premier. I'm wondering, will all hospitals, including the rural ones that almost lost overnight emergency room service earlier this year, be accepting and caring for COVID-19 patients?
So both RHAs, Vitality and Horizon, have been working together to look at the way that resources are going to be managed over the course of the pandemic. So I can't speak to the specific details around the decisions that have made around each and every hospital in the province, but I just can tell you that they are working collaboratively. We have 22 hospitals in the province, and so they have within their own pandemic plan that we are working together with the task force to really make sure that the most efficient and effective use of all the resources collectively is going to happen.
Thank you. Colin, do you have a follow-up?
Yeah, just a quick one for the Premier, again, following up on Silas's question. Is the Premier able to offer any specifics about what guidelines will be put in place here for nursing homes and long-term care homes?
Well, I think certainly, as I said, I want to review that, but there's been a lot of different standards that are put in place. I mean, for early on, we restricted any visitation of any kind. I mean, they're doing temperature sensing for all employees coming and going. They have protective equipment. They're wearing, I believe it's surgical masks as part of the routine now. And then the other training activities in terms of how to handle with patients, if there is an outbreak, how it's managed, and if there is any case. So I said I'm reviewing that. I know that Dr. Russell may want to speak to that in more detail than I can right now. But we are going to review that with our COVID team so that we see exactly what's being done in nursing homes, because obviously what we're seeing happening in Ontario and Quebec, we absolutely do not want to see anything like that here, and we're doing whatever is necessary to avoid any situation that would resemble that in any way.
Thank you, Mr. McPhail. Voilà la fin de notre mise à jour.
Thank you, everyone. This concludes today's update.
Thank you very much.